Afternoon, everyone. So it's really great to see these beautiful family members again in this meeting. So I would like to thank Sakthivel and all the other organizers for giving this wonderful opportunity. So every year I'm talking quite a lot about the public engagement work we are doing in India. So for a change, I thought this year I can present some lab work. Okay, so we all know about snake bite induced muscle damage. For every 5 minutes, at least 4 people are getting permanently disabled. And most of these permanent disabilities are coming from muscle damage induced by snakes. So there are different types of vipers. For example, in India, our hero city here, Russell's viper, that's the ruler of India actually. It's causing lot of bites, lot of disabilities and deaths. Then we got puff adder, western carpet viper, lancehead, and western diamondback rattle snake. So these vipers are causing exceptional amount of muscle damage. Okay, at least like 1 in 4 patients are getting some form of local envenomation effects. But unfortunately, the currently used antivenom is not preventing or treating this condition. So later on, if people are coming to the hospital later, this is what is happening. Like it can block the blood supply, that can lead to ischemia, the form gangrene, all these other problems. So in addition, people everywhere are using different types of inappropriate first aid that can cause more damage to the muscle as well. So currently, the clinicians are trying to use some surgical procedures, for example, debridement, fasciotomy. In worst cases, people are going for amputation in order to tackle this issue. So we wanted to understand why viper venom-induced muscle damage is not promoting regeneration. So, for example, normally our skeletal muscle has got an innate regeneration capacity. So, following an acute damage, it should automatically regenerate. But following viper damage, this is not happening. So that's what we predominantly focus in our lab, and we constantly look for different treatments, basically repurposed drugs to treat this condition. So glucocorticoids are being regularly used in muscular dystrophies, particularly in DMD condition, muscular dystrophy. So some studies recently suggested that if you use daily glucocorticoids, it can improve the muscle strength and it can reduce the injury, but metabolically it's causing a lot of effects and it's inducing huge amount of side effects. Okay, and this particular study said, why don't we give intermittent glucocorticoid rather than giving high doses of everyday injection? If you give intermittently, that can give some form of beneficial effect. So it's a pulsatile dosing, it's still giving the muscle strength, reducing the injury, increasing the metabolic rate, and the side effects are really less. So this is what that study. So they used the daily injections of prednisone and deflazacort, and also weekly doses, and they showed different biomarkers changing due to weekly doses of these materials. So there's only one study. We searched the literature, and there's only one study for both gerarchus venom. So I think it was back in 2009. So in this study, they used the deflazacort, but very high dose, just a single dose, 250 milligram per kilogram, continuously for 6 days. And then they found that a significant amount of increase in fibrosis and reduced the number of fibers, muscle fibers. So they concluded the glucocorticoids are no good to treat muscle damage. So following on the previous study, we thought, why don't we test the same concentration of those two glucocorticoids, see whether we can promote the muscle damage following venom-induced damage. So we used to see atrox venom here because that can cause huge amount of damage compared to a few other snakes. And we used both in vitro models and in vivo models. So in vitro, we are using cultured myoblast, human myoblast, and then differentiated myotubes to find out how the venom is affected and whether the drugs are changing. And then we also use in vivo model. So these are the two drugs we tested, similar to the previous study, prednisone and deflazacort. So first, we checked the viability of cultured myoblasts. So we used 2 different human myoblasts. One is AB1190, another one is AB1166. This is GFA conjugated. And clearly, atrox venom is reducing the viability of these cells. So here from like a 3.1 to 5 microgram per ml. So it's killing the cells, so it's causing the damage. Then next, we wanted to check on cultured myotubes. So this is called like atrophy assay. So we take the myoblasts, culture them for 2 days, and then put them in differentiation media and form the myotubes. And then you add the venom and see what happens. So as you can see here, the venom is causing a beautiful damage here. Okay, it's completely destroying the myotubes. and also some myoblasts as well at a very high concentration. Then we wanted to see what's happening to the differentiation. So you culture the myoblast, and then you add the venom in the differentiation media and see whether the differentiation of myoblast into myotubes are getting affected. Again, clearly the venom is causing huge damage here, and it's preventing the differentiation of myoblast into myotubes. Then we checked these glucocorticoids without any other inhibitors, just the venom and a glucocorticoid, pre-incubate and stick it in here. So the glucocorticoids on their own, they don't really cause any damage to the myotubes, but when you use with the venom, there is no effect. Okay, so it doesn't have any direct impact on venom itself. Okay, then we moved on to the in vivo model. So we wanted to give intermittent doses. So we took C. atrox venom and intramuscularly injected into the TA muscle, tibialis anterior muscle in mouse. And then after 1 hour, we gave a first dose of the drug. That's a 20 microgram for 20 gram of mouse, which is basically 1 mg per kilogram. And then after that, after 23 hours on the day 1, we gave next dose, and then only next day 8. We collected the muscle on day 7 and the day 14 to see what happens. So as you can see here, first we looked at the muscle weight loss. So the venom will induce a huge amount of muscle weight loss, and then these drugs are preventing that weight loss. And in day 14, it will automatically recover, so there won't be any weight loss here. And then we looked at the H&E staining to see the level of injury. So as you can see here, the venom is causing a catastrophic effect in the muscle. Most of the fibers are destroyed, and you can see huge infiltration of leukocytes in here. And when you use the drugs, the muscle looks much better. The injury area got reduced, and the injury extent, the percentage got reduced here as well. Then we wanted to see whether it's promoting the muscle regeneration. So again, in the same H&E, we measured the fiber area size here. So the venom is causing the damage, and the PBS control doesn't cause any damage. And then the drugs alone, they don't cause any damage. They look normal. And then with the treatment with the glucocorticoids, the fiber size is increasing compared to the venom alone. But still, it's not same as the control, PBS control. It's still lower than that. But compared to the venom, it is increasing the fiber size. And you can see a lot of centrally located nuclei in the fibers, regenerating fibers. So which means the fibers are regenerating really very well. And then venom-induced fibrosis is another big problem. So whenever we talk about muscle damage, fibrosis is a serious problem. Sometimes we can prevent the damage, but we cannot prevent the fibrosis. So we wanted to check what happened to the fibrosis. So again, venom is inducing huge amount of fibrosis, and these two glucocorticoids are reducing the fibrosis level. But still, it's not same as the control. So either we may have to modify the doses, or we have to come up with some other treatment regimens. Then we looked at the different cytokine levels. So clearly, the venom is changing a lot of different cytokines. I'm not going to go through one by one here. They include pro-inflammatory, anti-inflammatory cytokines, and some angiogenic factors as well. So clearly, the venom is increasing the cytokine levels. But when you give the treatment with these drugs, it's reducing. But in some cases, the drug itself is increasing the cytokine level because they are glucocorticoids, obviously. So in summary, C. atrox venom can cause damage to the muscles, whether it's a cultured myotubes or myoblasts or in mice, they can cause a huge amount of damage. Intermittent glucocorticoid treatments can modulate the cytokine levels, and they can enhance the muscle regeneration and reduce the fibrosis. However, we cannot use just glucocorticoids alone to treat the muscle damage or prevent the muscle damage. So we need to come up with some form of combinational therapy, for example, varoscletic to block the PLA2 or marinostat to block metalloproteases, and then try those type of combinations. And we should also try different concentrations of these glucocorticoids. We can't go extremely high because that will cause a lot of other problems. We are that. So we may have to do some form of dose optimization. So I would like to thank my lab members, particularly Jose, Gerard, everyone who contributed to this work. And finally, I wanted to announce one more meeting, as Glenn was saying. So Ron did say that we had several meetings this year, and unfortunately, we are adding one more meeting. So we've been dreaming about organizing a conference in India for ages, and we missed the ISC as well this year. So this is going to be an international conference of toxinology, predominantly snake bites and venom. So you should come. Okay, this is going to be in South India, in Tamil Nadu, a beautiful city called Madurai. So Madurai is a historic city. Okay, that's where the conference is going to be in Meenakshi Mission Hospital, and it's full of temples in there. So the conference is going to be on the 6th, 7th, 8th, including some clinical workshops. And then on the 9th, we're going to have a tour in Kodaikanal. It's a beautiful hill station right next to Madurai. Okay, that's what we're going to do. Some of you would have received email already from me, but remaining people will receive emails. But if you would like to discuss anything more about this, let me know, or you can email me as well. With this, I would like to thank everyone for your attention.